Thank you for registering on Skin Miles, and with this video we're going to be focusing on your specific skin concern following the completion of your skin assessment. And we will highlight just some of the products that are available, some targeted products that are available on Skin Miles for your specific skin concern. We take great pride at Skin Miles to try and educate all of our customers so that we can achieve the perfect skin regime specific for your skin type and skin concern. However, if you would like a more in-depth analysis of your skin concern, then please take our face-to-face skin assessment where you have the ability to send me a close-up or a high-res image of your skin or your skin concern, as well as a slightly more in-depth skin assessment questionnaire that needs to be completed, and then I look at each one of them personally, and I'll reply with a specific skincare regime for your specific skin type and skin concern. Thank you. Hi, I'm Dr. Alec Nikolic, and I'm going to be focusing on pigmentation and specifically what it is and how to treat it. Now, pigmentation or hyperpigmentation, those are those brown pigmented marks that we see appearing on our skin, can be a frustrating skin condition to actually treat. Now, most of us will not notice them until we're about starting in our 30s, but it also depends, the age where it starts will actually depend on how much sun exposure or if any specific cause happened earlier on in our lives. Now, what are the main causes? Because this also helps us decide what is the treatment modality. The most obvious one is excessive exposure to sun. Sun damage will eventually cause hyperpigmentation on the skin, very simply because the sun or the UV rays force the pigment cells which produce pigment, known as melanocytes, to produce the dark pigment which will then appear on our skin. And the melanin, they're there for a reason. It helps to darken our skin to help protect the skin from the UV rays. But in some of us, because of sunburn or because of excessive exposure, there's an overproduction of that melanin, and therefore that brown dark patch is seen. Other causes are hormonal, and that includes things like pregnancy and even the oral contraceptive pill, and this is given the term melasma or cloasma, and sometimes referred to as the mask of pregnancy. And this tends to be rather more thick, broad, confluent patches of pigment which can be seen on the forehead, on the cheek area, and even on the upper lip. It can look like a coffee stain in some of us, where it becomes very prominent. Other reasons for pigmentation include those that is caused from inflammation or infection, specifically after procedures. One can see that, or if one has some kind of trauma to the skin and the way that the skin heals, and this is referred to as post-inflammatory pigmentation. Both melasma and post-inflammatory pigmentation can be difficult to treat. It's not impossible, but it does take a lot longer than sun-induced pigmentation. I think up front, no matter what products we use for pigmentation, it is important that we should see treating hyperpigmentation as a management, as opposed to we're going to get rid of it completely. And if we look at what the treatment modalities are available today, is we can divide them into three broad groups. We have our topical approach, we have our lasers, and then we have our other. And that includes things like the dermapen with topical vitamin A. It includes things like LED lights, etc. The two most commonest approaches is our topical regimes and our lasers, and that includes your fractional lasers, IPL, etc. Now, let's focus on the topical approach. In the topical approach are also things like chemical peels, and that typically we do in our own clinical practice using glycolic acid or lactic acid combined with specific acids that target pigmentation and the melanocytes, or those pigment producing cells. And then typically we tend to advise, if we're going to treat pigmentation, the two broad categories or types of ingredients that you need to look out for is vitamin C and vitamin A or retinol. The vitamin C There are various different brands that make vitamin C. I've only put two here in front, but these two are both from SkinCeuticals. The one is the CE Ferulic and the other one is the Fulleretin CF. And typically this is applied in the morning after cleansing the skin. What can be done in the evenings is, after cleansing, you use a vitamin C product and you spot treat those pigmented areas. This is the C25 cream, has 25% vitamin C from Dermaceutic. Then in the evenings after cleansing, we typically would use retinol or vitamin A. This one is particularly from Neostrata, and these two are from Dermaceutic. This is a 0.5%, while the Dermaceutic have a 0.5 and a 1%. But these are quite reactive ingredients. They need to be introduced slowly into the skin regime, especially when we're targeting pigmentation. The skin will become used to it, and once it does, one can actually use it every single night. That's the end. I hope you found it useful and beneficial. You remember that you're welcome to send me any questions via email, or to take the face-to-face skin consultation, where I could have a closer look at your skin and advise skincare products that is specific for your skin type and skin concern. Thank you, and bye-bye. Okay, so I hope you found that video on your skin concern helpful and beneficial, and that it will guide you in choosing the correct skincare products for you. Just to end off, I'd like to say that Skin Miles offers free delivery on all doctor prescribed skincare products, and with it you'll receive a free sample. Will receive free samples specific for your skin concern. We also have an amazing reward system that, very simply, every time you purchase, you'll earn these Skin Miles, and they never expire, and you can use them to discount your future purchases. And last but not least, we also have a very in-depth skin blog on various topics, including skin regimes, ingredients, brand focus, etc., as well as providing the latest information in the form of clinical studies that have been performed with looking at specific skin ingredients. So to end off, I'd like to say welcome to Skin Miles. I hope that you find our site beneficial and helpful. And remember, look out for our thank you registration email, which should be appearing in your inbox soon. It's full of vouchers that will help you discount any purchase from any single brand on our site. Thank you and welcome.